Hi everyone, my name is Leslie Leach. I apologize if this looks a little weird. I'm trying to record this on my cell phone. My computer won't work. I was just trying to do the canvas. I think that's my husband's disabled a bunch of things on the computer. So anyways, I have been a nurse for about 6.5 years now. I currently work on the post-trauma floor at Medical Center of the Rockies. Actually, in about 3 weeks, I will be leaving post-trauma and am going to be ICU float pool. So I'm pretty excited about that. New change, learn new things, which will be wonderful. Before that, I was on the medical floor at a different hospital. Really enjoyed that. It seems like every floor you learn new things. Everybody kind of has a different population of patients, I would say. So as far as evidence-based practice goes, how evidence-based practice will impact my nursing practice, the main thing I think is you have to always keep an open mind. Just because the doctor says do this doesn't mean it's always correct. Patients, I always listen to my patients. Listen to coworkers, listen to the doctor, of course. But you just have to keep an open mind. Things are constantly changing. Evidence-based practice, there might have been a correct way of doing a specific, suture, or doing a specific anything, a catheter. 30 years ago, that was the best way to do it at the time, and then over years of trying different things, learning new things about infection, bacteria, all that, new practices and better ways of practicing have come out of that. And let's see, why will it be valuable to me and the patients I care for? You want to give your patients the best experience they can have while being a patient at the hospital. Nobody wants to be at the hospital. Nobody wants to be a patient. But you want to take care of them as you would want to be taken care of. And again, listen to your patients. If they feel something's wrong, they need something else, you're the patient's advocate. You're with the patient for, if you do the 12-hour shift, you're with the patient for 11.5 hours more than the doctor is. So you see them a lot more. Let's see. What is your commitment to evidence-based practice? Again, evidence-based practice is always evolving. Like I said, what was correct 30 years ago is not necessarily correct now, or the best way of doing things anymore. Some things probably are the same, and quite a few things are not. And again, you learn new things when you go to different hospitals. One hospital, everybody might do something a certain way, and then they say, no, don't do that. Just for instance, I just thought of one quick thing. One hospital I worked at, where I was taught, actually, we used the saline flushes to mix medication. We use that all the time. And then when I came to this hospital, they've got signs posted up that say do not use the saline flushes. And I was told that they're not sterile and you're mixing medication with not sterile solution. That's kind of hard for me to change because I was taught to use the flushes and that's just how I had done things, but I had no idea really that they weren't sterile or that it might have been harmful. So that is best practice to me, is that I don't really know how they came about that. Probably people were getting infections, I'm not sure. They realized those flushes weren't sterile, and we switched. So I think that's wonderful. And that's how things go. As far as colleagues benefiting from my commitment, same thing. We work as a team. They tell me things that they think are best, or they might have heard through the grapevine, and I do the same. That's how we learn. We teach each other. Okay, well, thank you.